Recordia, fáilte go dtí bailíocht lia má chathair féin. Friends, welcome to Dublin, my own city, in my own language in this case. I'm talking to you in October 2020 and I'm inviting you to the UFA conference in November 2021, from the 10th to the 13th in Dublin. As I speak, it's not clear what that means, whether the conference will be physically in Dublin, in which case I look forward to meeting as many of you as possible, whether it will be a virtual conference, as the Rome conference is, or whether it will be a hybrid conference of some kind. All I can say to that is watch this space. The topic of our conference is our food, our health, our earth, a sustainable future for humanity. And in this era of COVID-19, that's quite relevant. I suspect most of you watching this have had your lives consumed, as has been the case with me, since March of this year in dealing with the COVID pandemic in various ways, shapes or forms. As I sit here in October looking across the European landscape, I'm not optimistic. Most of our countries have, including mine, have failed to deal effectively with this virus. This is despite a history of planning for pandemics, which certainly goes back to before the Second World War. Why has it caught us on the hop? It's caught us for a couple of reasons. One of my colleagues describes it as an irritating habit of European exceptionalism, of believing that infectious diseases are something that happen to other people in other parts of the planet and don't really happen to us. Some of it is a simple unwillingness to make the necessary decisions and accommodate the necessary short-term pain to produce longer-term political action. And as we've seen, for example, in New Zealand and Australia, in Taiwan and China, taking these decisive actions early on can reduce the costs hugely. But part of it has been that public health has not been sufficiently politically engaged. Rudolf Virchow, who is the founder both of modern pathology and of social medicine, once said that medicine was a social science and politics was nothing other than medicine on a large scale. And I think there is a very large element of truth in what he said. Effective engagement with politics is central to the mission of public health. This does not necessarily, or perhaps even commonly, mean engagement with party politics. Some of us do go down that road, as I do, but most of us choose to engage with the political system in other ways and in other forms and in other methods. We engage with politicians, we engage with civil servants, we engage with the media, and we engage with the general public. And one of our strands in the conference is devoted to workforce and skills. And I think we have to ask ourselves, does our workforce have the necessary range of skills to accommodate future public health? Do we have the range of skills and capabilities? Do we have the leadership and coordination ability to get on top of the next pandemic? Because do not doubt there will be a next pandemic. COVID-19 in many cases is a good dress rehearsal for a truly bad pandemic. Our plans, I think, originally had been for a disease that was much more lethal than COVID-19 and that spread faster. And we're perhaps fortunate that we've not encountered such an infection yet. If we are to deal with it, having a sustainable model of healthcare, a sustainable model of an ecosystem, a sustainable model for food production will be very important. Our thinking around this conference is dominated by the idea of the One Health movement. This is viewing health, human health, as part of planetary ecosystem health, including animal health and plant health. It has to be said, our ecosystems are not in great shape. We have a segment on food policy, global health and sustainable development goals, and we have managed the considerable achievement of a food production system which neither benefits most of the primary producers nor most of the population. We have an extraordinary mixture which previous times would have found incomprehensible between rising problems from obesity in many countries across the world and at the same time persistent hunger. I'm ashamed to say it, but in my country, as in most other European countries, children still come hungry to school every morning. That's not right. And it's a measure of how badly our food production system has served us all. Changing that is a political change, but public health has a voice at that table. We talk about gender health. We've known for more than 40 years that one of the most effective methods of empowering a community is to empower the women in that community. But we still don't do it. And as our understanding of gender widens, broadens and deepens, as we come to understand that gender reaches beyond binary oppositions, that in itself generates a new set of public health problems and challenges, a new set of ways to support people living their lives, the ways in which they choose to live their lives in our societies. And public health is part of that. We have a section on digital health, and digital health is sometimes thought of as a relatively technical procedure, full of people who, if you scratch them, they bleed international standards, and who have dreams about interoperability all day long. And I'm one of those people, so I know where that comes from. But there is another side to digital health. Digital systems have been used increasingly to spread lies, let's call them what they are, about health, and have been used increasingly to spread hatred, fear, and division. This is a public health problem, as much as a political problem and a social problem. And we need to engage with ways of building digital systems that support our needs as human beings, rather than the immediate interests of those who sell attention and advertising. Finally, the overarching theme of our conference really is the climate emergency. And that drives a segment of our conference. And what I want to emphasize about the climate emergency is that the infectious diseases we've dealt with are not existential threats to our society. Human society will continue, with or without COVID, even if we have a truly bad flu outbreak, much worse than the 1918-1919 flu, something which is entirely possible, our society will continue. Those of you with an interest in history may care to look at the plague of Justinian and the various outbreaks of the Black Death in the 800s and the 1300s to understand how societies cope with truly devastating deaths from infectious disease. Climate change is not that type of threat. It is an existential threat, certainly to the existence of the industrialized society, which makes what we're doing even possible, and also possibly to the existence of our species. But we have the opportunity to do something about it. And it is up to us, it is up to all of us as citizens, as academics, as public health people, as people with high levels of resource, high levels of education, high levels of status. It is up to us to add our voices. As the old question goes, if not you, whom? If not now, when? We have power, we have privilege, we have agency. Let us use it. Let us use it in the interests of our species, of the rest of our ecosystem and of our planet. So, welcome to Dublin in 2021, and I look forward to seeing as many of you there in my beautiful city as possible, and if not, I assure you we will have an Irish experience for you across the electronic systems. Thank you.